Dr. Manning, thank you for joining us. Are you on there? Thank you for coming back, and we appreciate it very much.
Here, yes, thank you very much for having me, Governor. And, I'm really excited about this dashboard and the ability for families and pediatricians to see this kid-specific data. You know, and you've been a great steward of the fact that data really builds trust through transparency. It helps people feel informed. It lets us know how we're doing as a region, as a community, as a school district. And the data that's on the dashboard currently really reflects the experience that we've had across the state as we come together as children's hospitals through the Ohio Children's Hospital Association. You've heard me share before that we're incredibly fortunate that children do not seem to get very ill with COVID, but they do get COVID. And the data really reflects that. We have fairly consistent numbers of children positive with COVID, but fairly also consistently low numbers of children who are hospitalized or who are severely ill with COVID. You know, and finally, the last thing that this data really helps us do is it helps us track trends over time. We want to know if this is going to change. Again, we've been fortunate over time that the trends have stayed very low for children, but if that changes, the only way for us to know if that's changing is if we track that data over time.
Well, Doctor, talking about that, we've been at this 6 months, and I know you've been watching this very closely, not only watching it, but dealing with patients. What have we learned, and you talked about it a little bit, but what else have we learned about children during this period of time, or maybe what don't we know?
Well, we do know that children who are older and more mobile and more social tend to be more likely to get COVID. We do know that children, as they get older and have other health conditions, could be more seriously ill. We also know that children can be asymptomatic with COVID. And that, you know, that specifically strikes a lot of fear for people, I think, that there might be lots of children walking around carrying COVID. But, you know, on the reverse, we also know through testing thousands and thousands of children in Ohio before they go into surgery or have other procedures, children who are asymptomatic, we know that the percentage of those children that have COVID is exceptionally low. It's about 1%. And so even though we know that children can be asymptomatic with COVID, you know, the overwhelming majority of children who are walking around without symptoms do not have COVID, which is very reassuring. And finally, we're learning and experiencing right now as kids go back to school that the practices that we've discussed before, the safe practices of wearing a mask, keeping some distance, using hand hygiene, and cleaning surfaces, we know that those things keep kids safe. And if kids are safe, the adults in school are safe. And if kids are safe, the adults at home are safe. So it's all connected.
Well, that's great, Doctor. Thank you. And so for a parent who's not a doctor, let's say, and who wants to look at this, what do you look at, and how can you use this? How can this inform anybody who's watching today?
So I would tell parents of different age children, look at the data as it's broken down by age groups. That's incredibly helpful. And again, you'll see that in certain age groups, the rates tend to be a little higher. I would tell parents to look at the region in which they live so that they understand what disease is like in their community. As you've said, that what's happening in the community really impacts what happens in the schools. And then if and when we have data that's school specific, I know that families are really, really hungry for that kind of data. It reminds me of the data that we shared within our health systems early on that we were all hungry for. We wanted to know how many patients were positive, how many staff members might be positive, because that informed how we move forward. And finally, I would really emphasize that this data is so critically important for primary care providers and pediatricians. Pediatricians always have their finger on the pulse of what's going on in the community. They're always aware of what's going around, whether it's strep or flu or things like that. And now this really enriches their knowledge even more, so that if somebody were to go to their pediatrician and that pediatrician knew that COVID was occurring at different rates in that age group or in that region, that would really impact how they would practice with that family and that child. So lots of richness in this data.
Great. Let me just close with one last question. We had reported yesterday a case of flu. It was an adult, it was not a child, in Putnam County. So we're getting into the flu season, and I wonder, what is the protocol, what's the recommendation in regard to children as far as flu shots?
So thank you so much for referencing that, Governor, because it's so important this season more than ever that children 6 months and older can get a flu shot starting now, starting today. This is the time to do it before the season's really busy, so that you have a chance to develop your response. You really don't want to be the parent of the child who experiences what it's like to have a child who has flu and COVID. We don't want to learn what that is. We may have to learn that, but we shouldn't have to learn that because a flu vaccine is so helpful and so preventative. So go today, start today, contact your pediatrician and get your flu shot.
Doctor, thanks for joining us again, and we hope to bring you back if you're willing to in the future. We appreciate it.
Absolutely.
Thank you very much.